so much conversation from many people saying league should just stop for a week or 2 weeks or bubble up. Is that on the table when you have these conversations, Dr. Sills?
Well, everything's always on the table, Rich. We've always said we're open-minded to whatever it takes to keep everyone safe. And so you certainly don't want to rule out any potential option. I just would say that you have to look at the totality of the experience and the risks that are involved and what the risk of transmission is. And we've been at this now about 10 weeks. We've had over really close to 500,000 tests now. You know, we've had about 84 players and staff test positive over those 10 weeks. And in the overwhelming majority of those cases, you know, there has not been transmission in the team, meaning we had one single case. That's happened over 60 times, Rich, where we had one person test positive, player or coach, and there wasn't transmission in the team. Now, we don't want to get comfortable with that, and we certainly don't want to say, look at us, wow, look, we're leading the pack here. What we have to say is that our protocols have been very effective in most cases. Obviously, now we've had an outbreak on one team, and we've got a second team of concern. But the point is we have to look at each case individually and look and see what we're able to accomplish. And I think all these protocols are only as good as the compliance. I mean, we can have it sort of like a game plan, Rich. You can have the best game plan in the world. If we don't go out and execute it well, we know it doesn't turn out well. And kind of to stay in that football analogy mode, you can have 10 guys on a play doing their job. If one person's not, the play falls apart. So all that to say that we're vulnerable when we're not at 100% on our protocols. We've said that 90% or 95% is a failing grade here. That leaves too much opening for this virus to get in.
So what you just said leads me to my final two questions with you then. First things first is obviously you would be the one to help set the protocols up for a bubble. Is there a plan like in a top right-hand drawer somewhere? Because it would require a ton of moving parts. And union, league, so much more. Is there a bubble plan somewhere in somebody's top right-hand drawer to pull out if necessary? You find it necessary?
Well, we've discussed bubble scenarios all the way back into the summer when we and the union together looked at that. I think I would just tell you a couple of things about a bubble. There's no absolute bubble. You've always got people coming in and out, not players and coaches, but service workers, support workers, and things like that, and that can introduce the virus. And being in a bubble does not change the basic need for all the other parts of the protocol. If you're in a bubble, you still must do masks, you still must do distance, you still must do hand hygiene, you still have to change all of these things. So it doesn't change anything on our day-to-day operations. The other thing I think you have to consider there, though, Rich, is not just the infectious disease, but what's the mental health and the emotional and behavioral health toll inside a bubble. When you're asking people to leave their families and isolate themselves for months at a time, that's a substantial challenge for emotional and behavioral health. And I think that's something that doesn't always get discussed, but I think it's an important part of the calculation. So you're always looking at what can you gain and versus what is the downside. So I would just say we have all those discussions. We continue to evaluate. But our focus right now is on the protocols, which largely have been working, and trying to make sure we're all following them as carefully as we can.
And then the last thing that you mentioned that, in a team, it takes all 11, right, to matriculate a ball down the field, or all 11 to stop a team from doing that. If one person doesn't do the job, then that's a problem. Not to call anybody out, but in the 2 minutes that we have left here, obviously the Tennessee Titans, something's up there. We saw a handful of Raiders, while they were trying to do some good for a charity, went out. We've seen some coaches get slapped down considerably because they're not masked up. What do you say to anybody in the NFL community that still needs a message on this front, Dr. Alan Sills?
Well, we've said that it takes all of us, and I think maybe Coach Tomlin, I heard him quoted yesterday, who said when one person fails, we all fail. We're all in this together. But we also say this is hard. I mean, this is really hard. This is a relentless opponent, and as I said before, this virus only needs a small opening. And I think everyone has the best of intention. Everyone wants to stay safe. Everyone wants to keep their fellow team members and everyone in the environment safe. But it just takes that day after day sustained effort. And as a doctor, I know, Rich, there are plenty of times that I give advice to patients and tell them, here's the right thing to do, here's what you need to do. It's just hard to follow that all the time. We all recognize that. So I think we have to give some grace to people to say this is really hard. It's difficult to do it all the time. But really the only chance we have to stay safe, as I said, is to aim for that 100% compliance, to keep ourselves safe and to keep our team environment safe. And so we're going to continue to focus on tools that will help us do that. I know that the players, coaches, and staff are very committed, and we're in this together. This isn't about us being on opposite sides. We have one common opponent here, and that's this virus, and that's uniting the entire NFL at this time.